Hey guys, it's Shadow the Rat, and unfortunately today's video is something that was not planned, but it does need to be talked about, and that's because these two girls are probably going to have to be put down within 2 to 3 weeks. And I know that seems kind of crazy to say, you know, they still seem sort of alert, not much for Banana, but at least Fry does. But they have terminal cancer, and they're getting worse really quickly. So this is Banana. She's a 19-month-old rat. As you can see, she looks very slow, very out of it, and that's because she has a brain tumor, specifically a pituitary gland tumor. Now, some of you might know that I have another rat called Donut, who has been on treatment for a pituitary gland tumor for 6.5 months. Very successfully at that, and she has pretty much no symptoms. She has a full quality of life, and she's done really well on treatment. Unfortunately, that is not usually what you see with these tumors. Rats usually don't respond that well. And in fact, only one type of pituitary gland tumor in rats can actually be treated, and that is prolactinomas, which are a hormonal-based tumor. And these can be treated with prolactin antagonist like cabergoline, which is what Donut is on. Well, Banana started showing symptoms about a week back. At the time, she just seemed a little off. She didn't seem nearly as bad as she does now. Basically, she just seemed a little bit out of it, a little dull, kind of confused. And I immediately was trying to figure out what was going on. And then she started developing this symptom where whenever she was eating solid food, she would sometimes drop it, seem to forget that she ever was eating it in the first place. And sometimes when she was eating, she would jerk her head, which is something you often see with rats with neurological issues. She also had this weird behavior when eating liquid food where she would lick erratically all over the bowl, and she was very inefficient at actually getting food into her mouth. In fact, she tried to breathe in the food a few times, so I ended up having to switch her to syringe feeding, which is what I've been doing since then. So I knew something was up, and so of course I made her a vet appointment, and the soonest we could get in was Monday, which was actually earlier today. Anyways, like I was saying, something was very clearly off with Banana, and I suspected a pituitary gland tumor because her symptoms matched up pretty well, and I have had several past rats with them. And since I have my other girl, Donut, who's being treated for one, I decided to go ahead and dose Banana according to her weight. So I calculated it all out, giving her the highest dose for prednisone, which is a steroid and can reduce inflammation around the tumor, which can reduce pressure in the brain. And pressure in the brain is actually what causes symptoms with pituitary gland tumors. They're typically benign, but as they grow, they cause so much pressure to build up in the skull that it crushes the rest of the brain. And that's where all these symptoms you see come from. And the inflammation caused by the body's own immune system also causes a raise in pressure in the skull. So if you can reduce inflammation in the beginning, you can really reduce the pressure in the skull and as a result get back some quality of life. And these are just temporary stopgap measures because the tumor will keep growing unless you put the rat on something like cabergoline. And even then, unless the tumor is a prolactinoma, it will not respond. And so with steroids, you might get a few days to a few weeks of quality of life back. Or like Banana, you might not see much improvement at all. It's just a very difficult thing. And if you're not dealing with a prolactinoma, which I don't think we are, then you're not going to see much improvement, and the rat will need to be euthanized sooner than later. So I put Banana on prednisone and cabergoline on Friday. And like I said, I dosed the pred at the highest dosing possible, and I put her on the normal dose of cabergoline. It has much tighter dosing parameters, so to speak. But unfortunately, she has not improved. Maybe she had a little bit of improvement on steroids, maybe a little stabilization. She just had her second cabergoline dose, and it is possible that it will take up to one more dose to see any progress, even if her tumor is responsive. But really, we should have seen some response by now, at least to the steroids. So things just aren't looking super good for her. Anyways, I took her to the vet this morning, and the vet agrees with me that's probably pituitary gland tumor. And since I was using Donut's meds to dose her before, she went ahead and prescribed me Banana's own set of medications, the same ones, prednisone and cabergoline. And I also requested that we add in gabapentin, which is a pain reliever that can be used safely with steroids, unlike non-steroid anti-inflammatories, which cannot be used with steroids safely. So we are using something that can be given with steroids and something that's also really good for nerve pain and also is a good way to reduce the chance of seizures, which can sometimes happen with pituitary gland tumors. Basically, gabapentin is our best option here for pain relief, and because Banana has not responded strongly to steroids or to the cabergoline yet, because of that, we do want to put her on pain relief. So she is currently on gabapentin. All it will do is reduce her pain, so it won't actually affect the tumor. And unfortunately, I do think that Banana will need to be euthanized in the next 2 weeks. And if she doesn't improve, I'm definitely going to get her euthanized because it's not fair to let her slowly decline like this. That's what's been going on with Banana, unfortunately. And I know she doesn't look completely terrible yet, but these tumors progress really quickly, and I can tell you that she really isn't feeling great, and she's just going to get worse. Now, French Fry here was even more of a surprise than Banana. After I had called in Banana's appointment that night, I noticed that French Fry was shaking her head occasionally, more than usual, and she also had some pus in one ear, and it smelled kind of strange, like a sweet infection-y smell. So I thought I'd go ahead and take her in with Banana to get her treated for what I was thinking was a middle ear infection. Well, the night before I went to the vet's, which was Sunday night, I noticed that French Fry had this little lump pop up on her face, and that lump is on top of her zymbals gland. Rats have 2 zymbals glands, one on each side of their face, and unfortunately these can sometimes develop tumors called zymbals gland tumors, and these tumors have no cure. There's no way to prevent them, and there's no way to treat them. Or I should say there was no way to treat them, because there actually is technically a way to treat them now, only it's extremely difficult to find the correct machinery to have it done and find a place willing to do it. Plus it's also extremely expensive, and that's because the only treatment for this is radiation therapy, and it has to be done on a small animal irradiator, and those are pretty rare. You usually have to go to a very specialized, exotic, small animal center, and I was told by my vet the nearest one is several states away from me. And unfortunately, even though I do live in a college town with an amazing vet school, they don't have this sort of equipment, and there's just pretty much no place around me that has it. So I would have to drive for several hundred miles, and on top of that, French Fry would be declining, because the thing is, these tumors progress so quickly. First, you see no behavior changes, like with French Fry here. Maybe she's shaking her head a little bit more because it's a little uncomfortable, and unfortunately, we have not gotten her on the pain meds yet, because my vet wanted to start her on steroids first and then put her on pain meds just to make sure she isn't having an adverse reaction to either of them. But basically, she's going to be going on the same pain meds as Banana, so gabapentin as well. And she's also currently on a antibiotic combo. So hopefully that will take care of the infection in her ear and the abscess here, because what you're actually seeing is an abscess on top of a tumor. Because of the placement of the tumor, it typically forms an abscess on top. And this is why zymbals gland tumors are often misdiagnosed by both rat owners and vets, because they'll see that and they'll say, oh, that looks like an abscess, we can treat that. But the problem is that the abscess is because of the tumor underneath pushing everything in the face. So basically the entire face is getting misaligned because of the tumor as it grows. And you'll start to notice the teeth misalign and the jaw being pushed to the side, and you might notice an eye start to pop out and bulge and dry. It's just a really, really awful thing to see. And like I said, the only chance of any treatment is radiation therapy. And not only is that still highly experimental, because it's only been done on like 1 or 2 rats, although it was successful, but on top of that, you have to find a vet with very specialized equipment, and it's just not something that you can easily find. And also, like I mentioned, it's very expensive. So unfortunately, what that means is that in most cases, zymbals gland tumors are still completely terminal in rats. And all you can do for the most part is palliative care. And typically the tumor will start to cause some major issues for the rat within 2 to 6 weeks, even with palliative care. And because of that, the rat will need to be put to sleep once their quality of life starts to dip. Anyways, unfortunately, that is pretty much the update here. I know this is just really just so awful. French fry and banana are both probably going to be euthanized in 2 to 3 weeks. And it's not something that I wanted, obviously. It's hard enough having rats pass away when they're old and just pass naturally at home. But it's so much worse when you have a rat declining from a terminal issue, especially a younger rat like these girls, because they're only about mid-aged. And it's just so awful. But, you know, the kindest thing to do in this case is to euthanize them before it gets too bad. And so that's what I'm going to be doing. So yeah, that's it for this video. Hopefully these girls will have a good last week or two, and then I will be getting them euthanized.